Great. So thank you guys so much for having me. And I come to you from a really far away place. I am in Philadelphia. And so you're probably wondering why I'm doing this work for learning services, but I'm the person who does their university relations. And we are actually a company. Our big long name is Learning Services in partnership with ReMed. And that's exactly what it sounds like. It's two companies who have joined together within this past year, actually. But we share missions, and we've both been around for about 35 years with an expertise that has grown across that time in neurorehabilitation. So we are experts in brain injury rehab. By a little bit of introduction to myself is I am somebody who has worked in brain injury for all of my career, and I came to that professional experience by way of a personal one. So I had a brother who sustained a very severe brain injury when he was in high school and I was just beginning college. And through that experience, I gained a lot of insight into brain injury, interest in it, and some connections. And so when I graduated from college, it's the first place that I went to for a job. And I've worked in a variety of things across brain injury rehab. And we'll talk about some of those opportunities that are out there. I started in an acute rehab hospital back in long before probably many of you on this call were born, and worked on an acute floor for several years before going on to do case management. And then I went on and got a master's degree in healthcare administration, came back and did a number of things in terms of program development and administration. And most recently have been doing work in training and university relations, recruitment, and research. So what I'd like to cover today, it's probably a little different than some of your other presenters, but I just want to talk for a minute about brain injury so that people understand what it is. You'll probably work with people who've had brain injuries in your careers at some point, and then we'll touch on what some of the job opportunities are out there, and then specifically the jobs that we have at Learning Services in Gilroy. So just to give you an idea of how often brain injury happens, on the screen I'm showing some CDC surveillance data that comes to us from hospitals. And so what we're seeing here is 1 year's worth of brain injuries. So these are traumatic brain injuries where a person actually went to a hospital or an emergency room and got diagnosed with a brain injury. So we see in an average year about 56,000 deaths, 288,000 hospitalizations, 2.2 million emergency room visits, and then this very important bottom piece, which is unknown. And so we know that there are many more brain injuries than we're ever counting. Think about it, we're only counting those folks that go to a hospital and get diagnosed. So I have a son who plays all of the sports that will get him a head injury. And let's say that I take him to ice hockey practice and he cracks his head into the board during practice. And the coach calls me and says he got knocked out for a couple minutes, but he seems okay. And I call my pediatrician and she tells me, you know, keep a watch on him tonight and bring him in tomorrow. Or maybe she tells me to go to urgent care center and I do that. And let's say he does go on to have a concussion and maybe one that has a complicated recovery process. He'll never get counted here. Similarly, if you have an older adult, let's say, who falls and breaks their hip, and while they're in the hospital, everyone is paying a lot of attention to that broken hip. And they seem okay. Maybe they're a little tired. Maybe they're not quite themselves, but they're in the hospital. And then they go home and they start to have a lot of difficulty with their memory, with being organized, with having enough energy. And they eventually get diagnosed with having had a brain injury during that fall. They're not counted either, nor are people who are often victims of abuse. You know, shaken baby syndrome, abusive head trauma, child abuse, domestic violence, people who are risk takers and do things and then don't go to the emergency room or tell their parents, or maybe they tell their parents and they don't have insurance, or they don't want the aggravation of following up. So we know that there are a lot more brain injuries than we're ever counting. The people who are most at risk for brain injury are the very young and the very old. So you'll see here ages 0 to 4, 15 to 19. In that early years time, with the number one causes are both abuse and falls. From 15 to 19, we sort of see a shift to sports and recreation injuries and motor vehicle accidents, those new drivers. And then older people over the age of 65 are fastest growing demographic of people who are having brain injuries. And the number one cause there is, as you might guess, falls. In every age group, boys, males are having brain injuries more often than females. And those who are most likely to visit an emergency room, be hospitalized, or to die are very young boys between the ages of 0 and 4. You know, the big term for brain injury is acquired brain injury. And that just means it's something that happened to a normally developed brain after a normal birth process. And so, you know, someone who has fetal alcohol syndrome would not be included in this category. That's an injury that happens in utero. Similarly, someone with cerebral palsy who was likely injured during their birth process would not be counted here. Instead, we look at causes that come at that cause to a normal brain that aren't congenital, aren't hereditary, aren't degenerative. And so we have causes that can be internal and those that can come from the outside. The causes of an internal or a non-traumatic brain injury would be something like a brain tumor. Even if it's benign, a brain tumor is sitting in healthy brain tissue. It's taking up space. It's digging into places there where it shouldn't be. And if we go in and excise it and surgically take it out, we're going to sever connections on top of that. So brain tumor is a common cause. Anoxic and hypoxic injuries, those where the brain doesn't get enough oxygen for a period of time, are also common cause of brain injury. So here what we see might be a near drowning. That's a common one in children. Near strangulations. So sadly, if somebody attempted to hang themselves, for example, and was unsuccessful. And another one here could be a failed overdose, particularly around opioids. So someone who is overusing opioids and their respiration is suppressed, they're non-responsive for a period of time, maybe brought back by Narcan, they might not have had enough oxygen to their brain, and then we would expect damage to happen after a pretty short period of time, about 4 minutes. Another example could be a heart attack in this category. Infections of the brain are another cause, as are strokes, aneurysms, or AVMs. And then our exposure to toxic substances, things like lead poisoning, mercury exposure, pesticides, organic solvents. Traumatic brain injury is the one that we almost always think about within brain injury. And those are those injuries that come from an external physical force. So something like a fall or a car crash. We measure severity of brain injury at or close to the time of injury. So we look at how someone presents early on and with regard to whether or not they've lost consciousness or had an alteration in their consciousness. And we measure from mild to severe. An important point to remember here is that we're measuring really early on. We don't always predict by these measurements how someone will fare. I know a lot of people have had severe brain injuries, meaning that their coma was 24 hours or greater. And then they go on to return to their life in a way that is pretty remarkable without a lot of difficulty. But on the flip side, I know a number of people have had mild brain injuries, so concussions or just short losses of consciousness, who have had a lot of trouble going back to work, living on their own, succeeding in their relationships. The number one cause of traumatic brain injuries by a long shot, almost half, is falls. And that's something that has changed across the time of my career. When I started early on, the number one cause by a long shot was motor vehicle accidents. But you'll see here that traffic accidents are down at 14%. And there's actually two things that have happened, I think, to shift this rubric, if you will. So cars across time have gotten much, much safer. They're much lighter. We have airbags and harness seat belts. We now have all kinds of technologies that save us in cars, blind spot monitoring, backup cameras. So we've seen a real decrease in that area. And at the same time, we have this aging of our population, and that tends to be who's falling. Struck by and against injuries at 15%. Those are your sports, recreation, and work injuries. Typically, think about anytime there's a collision. Assaults at 9%. And then we have another 15% where either the person was found and we don't know what happened to them, or it was of a different nature. When people sustain a traumatic brain injury, it's something that is going to likely alter the course of their life. And people will end up having problems in a wide range of areas. So people will have physical and medical problems like changes in their sensation, their motor skills, their balance, their vision. People are more susceptible to have things like seizures. They also have a lot of neurocognitive problems, so challenges in learning new things, thinking and processing clearly, remembering, organizing, planning. And then, of course, there are behavioral and emotional outcomes after brain injury where people are not as able to regulate their mood as they once were. So downstream, we see folks who have mental health problems, particularly anxiety and depression, and social and economic outcomes of not being able to go back into the world the way they once were, not being able to resume their roles and responsibilities, and potentially their job. We also know that there are downstream health consequences of brain injury. So people will have more likelihood of having seizures, as well as all of your dementias, including Alzheimer's disease. There are greater risk for Parkinson's disease and also chronic traumatic encephalopathy, which is sort of thought of as that NFL disease where you've got low-level blows to the head repeatedly happening that cause an early dementia that is degenerative. Recovery after brain injury can continue for many years. We see most recovery, a sharp rate in somebody's recovery in the first 6 months, and then it still stays pretty aggressive. We're seeing a lot of recovery still through to the end of the first year. But then after that, it's mostly about a person making slow incremental gains that might not be noticeable very easily. Recovery is different for each person. And the key to making a good recovery is continuing to work that brain and practice things in a rich and stimulating environment. Therapy really focuses on using strategies to get around problems that you've had as a result of your brain injury and making sure that what we're working on is actually functional. It's something that's going to help you in your day-to-day life. And again, just this reminder that for many people, living with brain injury will be like living with any other chronic condition, like heart disease or diabetes. They'll need to manage it across their lifetime. Treatment for brain injury usually starts in a hospital and then is followed by a stay in an acute rehab hospital. Lengths of stay there are pretty short, so people might go from a hospital setting to an acute rehab setting and be ready for discharge within about a month of an injury. It's staggering when you think about it. It's a pretty big thing to come back from a brain injury. And so for many of those folks, they might need care after that point. And when we move past that acute rehab hospital stay, they go into something called post-acute rehabilitation. And that's what we are expert in. And so what are some of the careers that someone could think about in brain injury rehab? And from what I understand, I'm talking to allied health folks today, which means you guys could be going in any number of directions with your career. I know the speakers in front of me were mostly talking about nursing opportunities, and certainly we have those. But I think in brain injury rehab, you'll find a place for anybody who's kind of looking at a career in medical services or allied health services, any of the therapies, as a good opportunity to get some exposure to a clinical team and some practice and hands-on care. And so you see on the screen here a number of the positions that we have on board in our clinical teams. So you'll see the regular therapies that you think about: physical, occupational, and speech language therapy, psychology, therapeutic recreation. Then you'll see some ancillary ones that you might not be so familiar with. Vocational rehabilitation or vocational evaluators and job coaches, people who think about getting that person who's had an injury back to work. Cognitive rehabilitation specialists, really expert in memory, thinking, organizing, planning, a lot of the skills that people lose after a brain injury. Case managers and social workers who sort of rally the team around that client and work with the family to advance the plan. Nursing, of course, as we've mentioned, our clients have medical needs and medical complications, and our nursing staff, including CNAs, LVNs, RNs, BSNs, NPs, all work together to manage those medical complications for client and make sure that we are preventing them when possible. Behavior analysts who look at those neurobehavioral complexities and help us collect data and help clients make plans so that they can do better. And then the one I've highlighted in red, brain injury specialist. These are direct service professionals, and this would be an opportunity for anyone, whether they're in school or they've graduated. So this is an entry-level opportunity. There is actually a credential associated with the brain injury specialist through the Brain Injury Association of America. And so a certified brain injury specialist is a credential that one can look to get after they've had 500 hours of direct client care experience with someone with brain injury, and they have a supervisor who's willing to sign off on that. Then you're able to take a course, study a book, and obtain this credential. And so it is a nationally recognized credential and one that requires some contact hours every year to maintain, but it's something I put out there in case someone would have interest in it. So what exactly would a brain injury specialist do? I think one of the best analogies that I have heard for a brain injury specialist is that they are a therapy extender. And so if you can imagine this person after a brain injury has problems in all of the areas we talked about. So they have problems physically, cognitively, behaviorally. And we have all these therapists who are writing strategies and protocols for how that client can get better in those arenas. Those therapists can't be there 24/7 to implement those strategies with the client. So the PT is going to tell us the best way for someone to ambulate with a straight cane, or the OT is going to talk about their shower routine and the best way to cue them and coach them and help them through that process, but they're not going to be there every day. And so a brain injury specialist is someone who's going to help implement those strategies day to day across all of the activities that a person would be engaging in. So activities of daily living, personal care, meal preparation, community outings. We're going to be offering that cueing, coaching, encouragement, and sometimes hands-on care to clients when they need it. And the other part of the role is to communicate back to the team then how that client is doing with those interventions. And obviously, having a relationship with a client is a deep part of this role of brain injury specialist. And you really do, in this role, get a chance to make a difference in somebody else's life. And so our mission is to provide exceptional, innovative neurologic rehabilitation and supported living services to people who've had brain injuries, and to make sure that we're supporting our staff by providing this great environment and a lot of education in which to do their work. So here's a picture of our facility in Gilroy. It is actually a 10-acre ranch, and we provide intensive residential and transitional rehabilitation to people who've had brain injuries here. Our staff to client ratio is 3 to 1. And here on this facility, we have close to 30 beds. So it's relatively small. You know, it would be very different than a hospital environment. We do a lot of the work in the facility itself, but imagine a time when we get past COVID. Part of this role is also helping people as they regain their skills and go out into the community and practice the things that they've learned through their rehabilitation with us. We currently do have both part and full-time availability in our Gilroy facility. So I have evening shifts available. I have weekend shifts available. I have some night shifts available, and both part and full-time. And as I said, as you come on board entry level, you don't have to have a specific degree or qualification in order to do that. So you would come on board as a brain injury specialist. If you are a nurse and looking for that role, we'd also be interested in talking with you about that, find out a little bit about what you're specifically looking for, and then we can see if our schedules can match what you're looking to do. We do have a lot of training, so you don't need to walk in this door knowing much of anything about brain injury. We are super expert in that, and we will provide you both classroom style training and experiential training, where you're shadowing people, getting the lay of the land before you're actually expected to contribute, if you will, or work on your own. And so if you have any interest in brain injury or in working for us in Gilroy, I would encourage you to take a look at our website and to reach out to me directly. As the person who does university relations, I can kind of shepherd you to the right people without a lot of bumps in the road. And you'll see my contact here. My contact email, mschmit@remed.com. And with that, I'm happy to take any questions.
Thank you, MJ. That was very informational. We don't have any questions on the Q&A feature. However, I'm actually wondering, what are you looking for in an ideal candidate?
I think we're really looking for folks who are open to a non-traditional experience. So if someone is looking for that hospital experience where everything is just laid out in a standard way, that is not what they're going to find with us. So, but if you're open to learning something new and to testing your skills in a variety of ways. So let's say you are somebody studying nursing. Your role when you're doing vitals is also going to be to be able to interact with that client who might have a problem communicating because they've have a significant aphasia. And so you're going to have to be able to learn those strategies. Or you might be tapped to take somebody to go get blood work at a lab. And so your job is not just about the medical component, but it's about the community exposure. And maybe this is a guy who has a brain injury and, you know, says inappropriate things to women. So you're going to remind them in the car, like, look, we're going in, the phlebotomist is probably going to be pretty. What's the least you can do here? You know, like set them up and reinforce them when they do well. And so it's a much broader experience. But I find if people come into it with an open mind about what work could look like, it's a very rewarding experience. I think also for anybody who is early in their career and not sure about which direction to go, if they're thinking of multiple possibilities and they're early in their education, brain injury is a great early career experience because you will see it all. And you'll get to find out what you like, what you're good at, what you struggle with, maybe what you want to learn more about. And so I think it's just a great population exposure as well.
That's wonderful. Thank you so much. It's very informative.
You're very welcome.
Thank you, MJ.